Hello. This week we're going to talk about a very exciting topic, though not everyone feels this way. But it is, however, a very important topic in human services, and this is related to documentation and reporting. So we want to first talk about why it's important that we are thorough in our documentation reporting. What is the value of it in our practice? And then demonstrate clear written communication skills using appropriate professional language, and be able to document work with clients according to our agency policies as well as state and federal laws. So you will have this experience in your internship site of being able to practice some of the skills related to documentation and reporting. What are some of the types of documentation in human services? I've listed a few of them, but there are more than this. So on the clinical side of things, there's psychosocial assessment, and this is related to the assessment we did in our case analysis last quarter, as well as developing treatment or care plans for clients. There are regular progress notes that we make with clients, sometimes called SOAP notes. And there's also periodic reviews of clients, or closing or transfer summaries of our work with clients. On the administrative side, there's all kinds of different types of documentation here. We have program reports, and these can be to our funder or to our board of directors or to our community. And they usually consist of both statistics related to the work that we're doing as well as narrative. There's program evaluation, which is what you will be working on over the next few weeks for your organization. There might be a community needs assessment report that identifies some needs in the community that then your agency is going to develop a program around. There are annual reports, there are grant proposals and funding requests, there are marketing materials that we develop to let people know about our services. So there's all kinds of documentation at human services agencies. Now I want to spend a little bit of time talking about a really common type of documentation when you're working with individual clients. And this is called a progress note. And here is an example of a progress note known as a SOAP note. And this was a format that was originally developed in healthcare that has been adopted by the human services profession. And these notes are often kept after each visit with the client, or at least pretty much on a regular basis. So there can be either the SOAP note or the SOAPy note, and we're going to talk a little bit about that. So the elements of the SOAP note are called subjective, objective, assessment, and plan. And on the subjective side, this is how the client describes the situation, all the background information, how the client understands the problem, how the problem affects the client's life, and what the client hopes to find in regards to help or treatment. It may also include information from other people's opinions, such as family members or neighbors or even healthcare workers. So the subjective part is not necessarily fact. It's the perspective of the person who is giving the information. Now the objective part of the SOAP note is including all factual information. So it may include things like test results, like what the client's blood pressure is, or what the client's scores on the Beck Depression Inventory. It will cover your personal observations of the client's behavior, what you saw, and then any other information from outside sources, such as medical reports, results of psychiatric testing. So in this part, you're avoiding making any judgments. You are just reporting just the facts. So the A part is the assessment. It's your professional opinion of all the subjective and objective information. So you're taking all the information provided in the first two sections and using it to draw a final conclusion on the problem and the needs of the client. And this might also include a DSM diagnosis, if this is part of what you're supposed to do in your work. Then the P part is the plan. So after you've assessed what the client's issues and needs are, then you want to develop a plan, a treatment plan that will address those needs. This may include such things as referrals to outside agencies or consultations with other professionals. It may include ongoing case management or counseling that you are going to provide to the client. It may include education. It may include support groups. There's many things that could be part of your plan. Now, if you're writing a SOAPy note, then you are going to do the I part, which is the implementation of the plan. And it includes documenting all the steps of the implementation, doing ongoing documentation of how it's all going. And the E part is evaluating the success of the implementation after the plan is completed. Why is clinical documentation important? Well, for one thing, it measures how your client is progressing in the treatment, in the plan or the intervention or the services that you're providing. It will also let you know how a client has responded in the past to agency intervention. So if you're getting a client that is new to you but not new to the agency, you can look back at previous documentation to see what worked with this client and what didn't. It also is a way to document how clinical decisions are made, and this can have implications if there's any legal action brought against the agency. If you can outline what steps you took to come to the conclusion you did about the client to develop the plan that you did. Also, clinical documentation makes sure that there is continuity of care. If you are absent and the client comes in crisis, having your documentation will really help that worker to work with your client. And if you're referring a client somewhere else, or if a client comes back to the agency, as we mentioned earlier, having information about how you worked with the client will help a future worker. Documentation is also a way to help with supervision. So a supervisor can review your client notes and provide feedback not just on the notes themselves, but on the work that you did with the client. Also, clinical documentation is sometimes used as evidence in court testimony. So being able to document things appropriately with the right amount of detail, but not too much detail, is a good skill to have. You need to think about what if someone else is reading this who does not have the best interests of the client at heart. And documentation also protects the agency, shows that the agency is complying with standards of care, and it demonstrates that the agency is trying to meet the needs of the clients. So, for example, in a court case, suppose your client is involved in a divorce and there's a custody battle. You are working with the client on many issues, and maybe one of the issues you're working on is parenting. So how much information do you put in a client file about the parenting skills you're teaching them? You want to be able to document the strengths of the client, what they're doing to improve their situation, and not to put anything in the documentation that could harm the client in court. And this is a very tricky balance because you also want to be able to provide a realistic picture of the client to future people who are working with them. I think the other thing that's important about documentation is if it's not documented, it's like it didn't happen. So we've talked about clinical documentation. Let's talk a little bit about administrative documentation. Why is that important? Well, it's important in terms of legal requirements and accountability. So example, Child Protective Services needs to document all the work they do because they are accountable to the state legislature for the funding they receive and the work that they're supposed to be doing. So we also document to grant funders, agencies that fund our organizations. We also do documentation so we can monitor the quality of the services that we provide so that we can improve them. We also document so we can look for trends. Say you're working in a domestic violence agency and you find in your documentation that 50% of clients have substance abuse issues. So maybe then you will be looking for how to develop support services that help clients who are dealing with substance abuse issues, even though the main purpose of your program is related to domestic violence. So let's look a little What our professional codes of ethics have to say about documentation. Each code does talk about this, and so this is the Human Services Code of Ethics, and it talks about our duty to protect clients' privacy and confidentiality, except under certain exceptions, and to inform clients of those exceptions at the onset of the helping relationship. It also talks about our responsibility to make sure that our records are safe and secure, and that we have a process for how we share information with other professionals that has to include the client's prior written consent. The American Mental Health Counselors Association also has issues about documentation reporting in its code of ethics, and it also talks about clients' dignity and rights in terms of how you assess them and interpret their diagnosis, and to make sure that clients are receiving appropriate diagnosis and treatment. It also talks about how you should write your report so it's clear, concise, and easily understandable, that you're ensuring confidentiality and security of the information, that you don't release information without a valid release of information or a court order. And then it talks about, again, how you should write, maintain, store, and dispose of client information. The Social Work Code of Ethics also has information about documentation and reporting. Again, that the information is accurate and reflects the services provided, that the documentation is done in a timely manner, that you're not documenting things 1 year after the fact, but that you're keeping up with your documentation and not letting it pile up so that it's most current and accurate. Again, we're looking at clients' privacy and storage of records and how long they should be retained. So we can take from all these standards and that good clinical documentation is timely and up to date, that it's accurate and concise but complete, that it's tactful, that it's strengths-based, that it's professional, and that it's related to your observations, and when there is a judgment that you name it as such. So it distinguishes facts from impressions, and this is where the SOAP format comes in, because then it's very clear what are the facts and what are the impressions, that it's professionally written and grammatically correct, and that you limit the use of acronyms and abbreviations because not everybody will understand what you're talking about. Also, as I said, it highlights clients' strengths and coping and how hard they're working, documents what services you provided, the significant contact you've had with clients and other people in the client's life, and your documentation should link to the treatment plan goals. It should indicate who has provided the information, and you can do that by saying the client reported, or you can use direct quotes if you want to say something word for word that the client said. It should be dated and signed by you. There shouldn't be parts of it whited out, and it should adhere both to the agency format and to the laws regarding privacy and confidentiality. These laws, there are federal laws, state laws, and agency policy, all related to ensuring client confidentiality. So the Federal Health Insurance Portability and Accountability Act of 1996, which is a mouthful, but we call it HIPAA, has two key purposes. One is to protect health insurance coverage for people when they change and lose jobs. But the one that's relevant here is that it creates national standards for electronic healthcare transactions, including the security and privacy of patient health data. And there's some pretty strict regulations in the HIPAA Act. And it's something that would be very good for you to be familiar with. The Health Information Technology for Economic and Clinical Health High-Tech Act has even stricter guidelines related to electronic health records, and also greater penalties for violations, both at the individual and agency level. These rules apply to healthcare facilities and providers, to counseling and therapy notes, chemical dependency and mental health treatment notes, and some other human services organizations that are considered covered healthcare entities. So the other issues about client confidentiality is that you ensure that you are following a good informed consent process where you are meeting with the client at the very beginning to tell them about how their records are being kept confidentially and where you cannot keep things confidentially. For example, if a client is expressing the desire to harm themselves or others. That your electronic records have good encryption software, that access to all records is restricted, that there's a retention and disposal plan and policy. And you should consider not just the clinical notes, but also client appointment and billing systems and communication you have with clients through phone, Skype, email, or text messaging. There are some of these methods that are more confidential and better than others. I just want to also mention that there are many people who have access to client records. Insurance companies who are paying for the client services and managed care organizations, Medicare, Medicaid, other agency and organizational staff, other counselors, healthcare providers, and agencies with assigned release of information, authorized family members with the permission of the client. The client can also have access to their own records. The legal system, if they present you with a valid subpoena, and sometimes pharmacies and drug companies when you write prescriptions for clients. So it's very important to think about all these companies and people as you're writing the client notes. So your notes should, in summary, demonstrate good clinical decision making on your part, outline what the client's strengths are and the work that the client is doing, and keep a running record of the progress that the client is making. So this is just some more information that will tell you a little bit more about Washington state laws related to client confidentiality and record keeping.